Hi, everyone, and welcome to this TechNet webinar series on capacity development and professionalization. Thank you very much for joining us today on this new webinar series. And this first session today will focus on the critical role of health supply workforce in driving immunization and health outcomes. You can listen to this presentation in French. So this session is interpreted in French. To listen to the French presentation, please select the globe at the bottom of the Zoom window and choose the desired language. If you struggle to find it, please do let me know in the chat area. Talking about the chat box, you can already introduce yourselves and tell us where you're from and your name. We'd be happy to know that. You can also use the chat box if you need any technical support. I'm here to help you as much as I can. So I see that some people are already joining. Hi, Mohammed, and how Geta and Zosimo. If you have any question during the presentation, please use the question and answer box. It's available at the bottom of the Zoom window. Ask your questions at any time. Our panelists will answer them after the presentation during the Q&A session, during the question and answer session. Finally, this session is, as per usual, recorded in English and in French. We'll share with you the links to the videos as well as the slides. The slides will be only available in English. I hope you'll enjoy this session, and I'll give the floor to Dominique. Dominique, the floor is yours.
Thank you, Alexander. Just turning on my camera. Okay, there we go. So, Ronan, next slide, please. Thank you. So, good morning, good afternoon, and good evening, everyone. My name is Dominique Swinkels, and I'm very happy to be here. As you may have seen, this is the first of a series of webinars on capacity development and professionalization. This is the very first one, and I am joined today by my fellow panelists. You will meet Michael E. He's the Supply Chain Management Workforce Development Specialist at USAID, GHSC, PSM, IntraHealth. You'll also meet Mwenge, who is the Senior Manager, Supply Chain System Design and Integration for Gavi, as well as Bill Keogh, the Supply Chain Talent and Organizational Strengthening Advisor at JSI. I also have the opportunity to introduce you to Ronan Tiraj. He's my colleague within People That Deliver, and he'll be at the end going through a number of questions with you. So I am the executive manager for People That Deliver. In a moment, I'll explain to you who People That Deliver is. But basically, we are set up to ensure that, just go back, please. Thank you. To ensure that supply chains are only as strong as the people managing them. And that's really our motto here. But yeah, next slide, please. So we are the global technical leader in human resources for supply chain management, the only global body that brings together a variety of different stakeholders to address the people working in health supply chains in low and middle income countries. We are the conveners of diverse organizations, the leaders in technical information, and the advocates of supply chain professionals. Next slide, please. We were established in 2011 to advocate for a systematic approach to human resources for supply chain management. We are a global coalition, a global partnership, building on the experiences of our coalition members to advocate for change at global and country level. This results in stronger and more sustainable systems for developing, recruiting, and retaining a qualified health supply chain workforce. The 7 different constituencies that are part of our coalition are listed here, as you'll see in this slide. Next slide, please. And basically, this is our coalition. Our strength really is within this group of 28 organizations. As you'll see, the constituencies are technical partners, NGOs, donor agencies, we have the academics, we have private sector, as well as the UN agencies, and we are hosted by UNICEF Supply Division in Copenhagen. Next slide, please. So our vision is really a world where health supply chain workforces are empowered and equipped to optimize health outcomes by improving access to health commodities. Our goal is to create a competent, supported, and adequately or competent staffed supply chain workforce that is deployed across the public and private sectors within the health system. Next slide, please. So really, why do we focus on human resources for supply chain management? With a third of the world's population not being able to access medicines and a lack of human resources in many sections of healthcare, then why HR for supply chain management? So for us, we have some very big reasons for that. First of all, supply chains are a key enabler for all health programs. I'm sure many of you have heard the tagline, no product, no program. Supply chains for health commodities are particularly important for the delivery of health commodities. If you do not have the right people with the right skills running those supply chains, supported by appropriate human resource policies and supervisors to monitor those people and ensure that they are motivated, you will not have well-functioning supply chains. From research that we have done within the people that deliver, the following challenges all cause a reduction in supply chain performance because of workforce-related issues, such as the fragmentation of the responsibility for managing the overall performance of a supply chain, the lack of planning and financing for such a workforce, as well as the lack of development and credentialing for supply chain managers, the lack of accurate job descriptions, as well as sort of the lack of professional development and professionalization, professional association, excuse me. Thank you, yeah. The other element is that we focus on human resources in supply chain management because there is an increasing pressure on health supply chains. Current stressed supply chains are becoming more stressed with the increase of products flowing through them. These charts show an example of how a 24-fold increase in the value of new vaccines introduced into a country resulted in a 5-fold increase in the workload. This is specifically from data from Chad. But of course, this is not only the case for vaccines. We see this as well in non-communicable diseases, such as heart disease, cancer, and diabetes. The number of products required by governments to look after these diseases is ever increasing. This is the same for HIV/AIDS, with a changing environment for these commodities in line with new treatment regimens and universal health coverage, where countries are increasing their health packages to beneficiaries and patients. This also means the number of products flowing through the supply chain are increasing. It really demonstrates that decisions to increase the availability of health commodities in a country must take into consideration the ability of the supply chain workforce to absorb the extra workload, which might require expanding the workforce or in some cases reorganizing it to make it more efficient. All too often, the health supply chain workforce is not considered when such decisions are made to introduce new products into a health system. So next slide, please. So basically, what we're trying to do is we're moving away from sort of the current paradigm that's in place to a more desired paradigm where we have a professional status and professional performance. This new paradigm for the supply chain workforce would be one where they have an elevated status and access to relevant incentives as well as resources. Supply chain positions in health institutions are defined and require personnel with relevant qualifications and experience. No longer only pharmacists who are already short in supply to manage pharmaceutical supply chains with little training. These supply chain workers have career incentives, including a career ladder within health supply chain. And specifically something that's then stimulates the supply chain workforce performance, satisfaction, and retention. Supply chain positions become attractive because of their formal status and appropriate career incentives, leading to a market of individuals who seek such qualifications. National and regional institutions provide these qualifications to meet the market demand. And then national health institutions can then more easily fill these supply chain positions with qualified personnel. Next slide, please. And so this brings me to our theory of change. And maybe some of you have already seen this in the past, but this is really our foundational approach to human resources. It was developed in 2018. It centers on 4 pathways: staffing, skills, working conditions, and motivations. These really are the conditions needed to ensure that workers at every level of the supply chain perform optimally and impact the availability of health commodities, including the improvement of health outcomes. So, yeah, thank you. So this then takes me to the supply chain management professionalization framework. We developed this in 2020 after the theory of change. And this is really a set of global standards that align career path, education, and professional advances to professional growth in supply chain management. The goals, as there's a few of them stated here, but really is to establish and standardize roles, the knowledge, skills, and abilities, elevate the status of the profession, guide the conduct of supply chain management specialists at country level, enhance awareness of career paths, facilitate recruitment and retention, and then most importantly, then develop that supply chain management leadership pipeline. So both the theory of change and the professionalization framework you can find on our website, peoplethatdeliver.org. You'll find that within our professionalization framework, we have a number of very handy resources, especially when you're thinking about developing job descriptions, looking at all the different supply chain roles by level of the health system, and start thinking about what kind of educational opportunities exist. This all builds into an implementation approach that we have developed for health supply chains. And with that approach, actually, I'm going to introduce you now to Michael E. We have a number of professionalization efforts underway, and one of them is in Rwanda. Actually, let me go to the next slide, please. Yeah, this is my final slide before Michael comes in, but we have been driving these efforts in 3 different countries currently, in Nigeria, Rwanda, and Mozambique. In Nigeria, specifically, we're working with MPCMP as well as ARC ESM to start to professionalize the supply chain role. In Rwanda, Michael will provide you much more information on that. And in Mozambique, we're working with the Central Medical Store, CMAM, to as well professionalize the supply chain role at country level. And so with that, I'm going to pass this on to Michael.
Thank you, Dominique. Next slide. Okay, to continue from where Dominique talked and to take you through what we've been doing in Rwanda, she did mention that the implementation of the framework, professionalization framework, is in phases. So that is the step we're taking or navigating in Rwanda. In phase 1, what we did was to carry out an advocacy and awareness creation. What that meant is that we mapped out the stakeholders in the country because we need to leverage on their strengths in these pursuits. And then we reached out to them. We had numerous meetings. We did webinar. And in that webinar, many folks attended that webinar. And from there, we moved on to phase 2. Just to mention that advocacy and awareness creation is a continuous exercise. It's going on in phase 2, phase 3, and going forward. So in phase 2, what we did was to organize a consultative meeting. And in that consultative meeting, we brought all stakeholders together to present to them what the supply chain professionalization is all about, the benefits and the need for them to key in and support. And at the end of that meeting, we got commitment from all the stakeholders that we're going to support in any way they can, individually or via their constituency. And that led to the development of a project charter, which has all the points documented. After we've done that, we moved on to phase 3. In phase 3, we are to do a process mapping, and to do a process mapping of all the activities and processes and procedures of supply chain management in a country. We need to develop a process mapping tool. We're able to develop that process mapping tool, and then we started gathering data to impute in the tool. To cover the entire country, focusing on the public sector, we focused on the Rwanda medical stores, the branch RMS, Rwanda medical stores, and then the service delivery point. The service delivery points are comprised of 4 other sub-levels, which are the teaching hospital, the district hospital, the health center, and the health post. If you notice, all these places I just mentioned is where you have the health supply chain management workforce working, from the central to the intermediate and to the service delivery point. The data that we want and we're going after are the job descriptions of whoever is working in these the levels. Where we did not find job descriptions, we created an open-ended questionnaire sent to the people that are doing the work to gather information of what they do on a day-to-day basis, and then it's followed up by interview, so as to have all the information we require in the process mapping tool. As you can see, phase 4 and phase 5, we've not gotten there. We are currently in phase 3. Next slide. So what, at the end of phase 3, what we want is to generate a supply chain professionalization in Rwanda context. And in that document, you have 3 audience targeted. First is the supply chain workforce himself or herself, all right? The document will be supporting the workforce. It will be amplifying the career pathway for the supply chain management workforce. What do I mean by that? For someone that is in the district hospital or the tertiary hospital and doing quantification or inventory control, should be able to see another person, a colleague at the intermediate or the central medical stores that is doing the same job. But this time we'll be seeing the competencies required for that person to be doing that job, so that he will be stimulated to have to see that career path, that he has equal chance of competing for that position by building his competence. So you will see area of gap that he has, and then he will build up that confidence to be able to compete for higher position. So this will be done for all the domains of supply chain. Then what will this document do? It will also support the Ministry of Health to establish job description for supply chain management, especially at the service delivery point level. What we find is, as we gather information into this process mapping tool, we realize that for the people in the service delivery point area level, their job description does not carry supply chain activities. At most, it's just one line of all the activities of supply chain that they are doing. So again, that one line does not satisfy it all. And moreover, the person that is actually even doing the job does not know the arrays of activities embedded in that line. So this document will be outlining all the job description at that level for service delivery point. For those that already have job description available, a summary of the job description will be provided, and then the process activity for each cadre of staff at all levels. The document will be spelling the required competencies per role. Talking about competencies per role, the document will help in anyone that want to assess the incumbent, the staff that is occupying that position, to see the gap that they have, and then that can inform the training needs assessment and eventually the training of that person. It will give us also the key performance indicators per role, the supervisory count per role, and the prescribed training and experience per role. So with these arrays of goodies and values that the document and the pursuit will be adding to the system is for sure going to move forward. Next slide. So talking about the support to institutions of higher learning, what we find out in the whole of labor market analysis, these are activities that took place before we got to where we are. We saw an imbalance between the supply of the workforce and the demand for the workforce. We saw an imbalance there. The imbalance manifested in a way that individuals that comes out from our institution of learning are not equipped to do the work that is required in the labor force, in the labor markets. And this is as a result of reliance on old curriculum. So what we put together, the compilation of competencies, we influence the curriculum of supply chain offering in these institutions. And these are decisions that we engage when we're doing the whole of labor market analysis, with the hope, of course, it will be followed up by rigorous advocacy for their curriculum to be influenced, to be updated, so that as student is graduating from high institution of learning, they are ready fit in the market to take on the responsibilities in the market that their employers employ them for. At this point, I will be handing over to Dominic. Thank you.
Thank you, Michael. Okay, so before we we jump into the Gavi 5.0 immunization supply chain strategy and the specific priority of investment in capacity development and professionalization, I just also wanted to highlight the funding priorities by the 3 other major donors in this area. I've been working with all 3 of them, and I just wanted to also highlight this to the audience today. Specifically USAID, they have been funding the People That Deliver significantly over the years, as well as Michael at the Global Health Supply Chain Summit PSM project. So basically USAID has a systems approach and is focused really on institutional capacity building, promoting that transfer of skills to in-country counterparts, and establishing the systems and mechanisms for sustainable local capacity development. What they do is really address the whole of labor market by looking at interventions around professionalization, standards, workforce planning, and higher education. And so very much this professionalization framework and the approach that you just heard of was very much funded by USAID to really start to look at this this area more holistically and really take a systems approach to investing in human resources for supply chain management. When it comes to the Global Fund, they are very much, as many of you probably know, they're very much strengthening and accelerating the development of efficient, agile, and people-centric national health supply chain systems, basically to ensure equitable access to quality assured and affordable health products. And what they're doing is specifically in capacity development and professionalization is really supporting the countries to structure, develop, and professionalize the capabilities to operate their own supply chains. And so we have seen them very much working to develop that leadership capability as well. And in this webinar series next week, we're actually going to be highlighting the STEP 2.0 program, which is all about supply chain leadership and change management, and of course, developing your teams in supply chain. And the Global Fund is a major donor of that, as well as USAID. And then the third funder that I just wanted to highlight is the Bill and Melinda Gates Foundation. What they're doing currently is really crowding in new partners to contribute to supply chain professionalization and capacity building. And their investments are about injecting industry best practice into the development ecosystem. And so for them, it's all about empowering local partners to be able to contribute to professionalization. And one of our major partners is Village Reach that are taking those efforts forward. And so with that, I'm going to now pass it on to Mwenge. He's going to be speaking about Gavi's 5.0 supply chain strategy and this priority area that they're investing in. And of course, they're also a big donor when it comes to the STEP 2.0 program. So over to you, Mwenge.
Thank you, Dominique, and good afternoon, everyone. So I'm going to present to you the Gavi 5.0 immunization supply chain strategy for 2021 to 2025. So basically, the Gavi immunization supply chain strategy theory of change provides a visual pathway. And this is really looking at achieving the vision of strong supply chains that enable the delivery of life-saving vaccines to every person when needed, and also to ensure that no matter where they are, these vaccines reach the people. And in this theory of change, I mean, you're looking at different components, and then there's the challenge that we face currently, and this is what is driving us to look into the solutions of these issues that we have. Then we look at in the investment priorities and expected outcomes. We're also looking at what are the impact goals, what we want to achieve, how are they going to impact on with the work that we're doing. And then, of course, we really want to look at what are the enablers that we can really take, and definitely the vision statement. So with this, this forms part of the whole theory of change that that Gavi is doing. Then, if you look at the IS strategy theory of change, you can see where capacity development and professionalization is situated. Following the problem that we've identified, we have the Gavi IC investment priorities, and you can see the Gavi development, capacity development and professionalization. So this now, as you can see on the right side, we have what we want to see, what are the outcomes, the intermediate outcomes, and you can see where they are situated there. That is looking at the supply chain should be adequately staffed at all levels with motivated and competent workforce, and also the country leadership determines strategic decision direction for supply chain. Now, if you see, we have 6 impact goals, and you can see how the supply chain, the capacity development and professionalization is impacting on almost 5 impact goals. So it just tells you how important it is that if we neglect this part of the investment area, we can see how it will affect our impact goals. So in our impact goals, we're talking about the availability, not just availability, but definitely high quality vaccines should be available and in adequate quantities. Like I said in the vision, when and where they are needed. We need to talk about efficiency issues. We need to have well-functioning supply chain to minimize operational costs and product waste with interconnected people, systems, and structures put in place. We're also trying to see how resilient are these supply chains. We need to be resilient and agile to ensure that they serve their purpose. And we also have to look at how responsive are these supply chains. So they have to be very responsive, and most important also sustainability. So they must be sustainable. So government-led supply chains should be financially and programmatically, environmentally, and socially sustainable. So these are all the important aspects that we are looking at in this area. Now, you have to look at what are the practical approaches for the strategy to get implemented into action. So we have to look at, after looking at all these investment priorities, but we have to look at how will we implement in a practical sense what we've put across. So under the capacity development and professionalization, we have to look at issues to do with supply chain competencies and structures, and also ensure that we strengthen the skills, and not just strengthen them, but also ensure that we apply these skills that we strengthen, in people. We need also to see how do we identify effective incentives and things that can motivate the workforce. And also, it's important to have and create a healthy work environment. Very important. So this is how we intend to make these approaches to be more practical in terms of implementation. So you have some of the areas of opportunity that we have, which correspond with some of the practical action. If you remember, I think earlier on, Dominique mentioned some of the issues that impact on supply chain human resources. But so if you look at the areas of opportunity within the capacity development and professionalization, we are trying to see how to look at supply chain competencies and structures. Like I mentioned earlier in the previous slide, strengthen and apply skills, identify effective incentives and motivations, create health work environments. This is really a follow-up on the previous slide. Then, when you see in these areas, we really try to break it down. I think the previous speakers has talked about the job descriptions and the clear roles and responsibilities, and how to review and optimize and strengthen organizational structures and policies. This is very important. However, it is also important to note that we should ensure that trainings that we conduct should not just cover, should cover all areas of the supply chain, rather than what we've experienced in sometimes, where you just cover the specific topics. So you have to cover all the areas to be more effective. We need to ensure that training is really, we involve the training, the pre-service, and also after that we do the mentoring and the post-training, and also partnering with other organizations. We need also to encourage the use of innovations in we need to encourage the use of innovations in training, like the use of mobile phones with specific training modules on different topics. So innovations come in quite handy in this area. So basically, I think we really need to move quite in a more holistic approach. Can we go to the next slide? Again. The slide is not moving, so move, next. Next. Okay, thank you. So when we talk about now all those areas in terms of practical approaches, we also need to start measuring our impact. So what changes are we going to see, and how are we going to measure the progress? So in terms of the kind of change we want to see increased availability of life-saving vaccines. We want to see improved performance of the immunization supply chains. And in terms of the increased availability, we want to see what is the full stock availability. And we have our baseline. So we're looking at the baseline of 2021, where we're at about 82.5%. And we're looking at DTP and the MCV. So to move from here, by mid next year, 2023, for example, we want to move to 85% and 93% MCV. And hopefully at the end of this strategic period, in 2025, we move to both vaccines in terms of 95%. In terms of, if we look at the composite EVM scores, we want to move from the baseline of 70.5% to about 75% in 2023. Actually, at the end of the strategic period, we're trying to see how we can move to about 79%. And also, we want to see that availability, quality, and efficiency scores really also go up from what it is what it was in 2021 at 12%, move at least by mid next year in 2023 to 20% and eventually to 25%. And these will be measured the measures will be on an ongoing basis, and from time to time reviewed by the IC to biannually and reported annually. So the WHO will get the reports on this, and this is where we want to move. Next slide, please. Right. So in terms of, as we continue to see, what is it that we really want to see? Now, in the 6 investment areas, when we zero down on the capacity development and professionalization, we also want to see the percentage of countries that have conducted an EVM2 assessment to have moved their scores above 80% in the C4 category. That is recruitment, training, and knowledge of staff, that they meet these EVM standards. And we have our baseline here, as you can see, about 54%. We want to move to above that in the 2023 to about 65%, and indeed 2025 at the end of the strategic period to about 70%. So this is how we want to measure in terms of the investment area. Next slide. Now, Gavi, as Dominic mentioned earlier on, we've supported step 2, and this has been coordinated by people that deliver, and it's jointly offered by 4 donor agencies, which are linked by the collaboration framework, which was signed in February 2021. And these are Gavi, Global Fund, IFPW Foundation, USAID. Each donor agency has a pool of implementing partners to deliver step 2 in country, and they are shared across agencies. So the following represents some of the Gavi's validated implementing partners, and you're talking about Yale, Ganshed, Impulse Core of Health, Belgium Consulting, Geneva Center for Security Policy, Village Reach, and Logivac. And just to mention also that over the years, Gavi has invested quite a lot in capacity building through HSS grants. And as a result, if you look at the EVM scores, they have improved in this area. For example, if you look at the EVM score, E8, the score improved from 71% in 2015 to about 84% in 2021. So you can see the improvement. So as part of the effort to improve this area, you can see how the funding through the HSS grants has resulted into the higher scores. So it's encouraging that we should continue investing in capacity building, so we'll see the results that we have. We also have some strategic funding area, SFA, funding of about 125,000, which will be used to co-fund the Global Fund program in Ethiopia. And this will result in the addition of about 10 to 15 participants to the program. So basically, this is what I had to present for you from the Gavi side. Thank you very much for this opportunity. Thank you, Dominic. Thank you.
Thank you, Moringa. That's fantastic. Let's also not forget all the investments that Gavi has made in the first 5 years of the first generation of STEP. But of course, we're very much hoping to see more investments in STEP in the coming years. So now I'm going to pass it on to Bill, where he's going to speak about the sort of the vehicles for capacity development and professionalization. So very interesting. So over to you, Bill.
Great, thanks, Dominique. I'm Bill Keogh with JSI. And before I get started, I just want to take a minute to just thank UNICEF and Gavi for putting together such a thorough and comprehensive framework to help guide our discussion. So I think Mwangi already shared something similar. Ronan, you can go ahead. And so this is the piece of that's the piece of the overall strategy we're focusing on. Here, there's a further drill down into the sort of practical actions that can be taken to implement this strategy. And Ronan, I'm going to talk about two of them that I think are the most important. The first is sort of supply chain competencies. And Ronan, if you want to go ahead too, that would be great. Supply chain competencies and structures, and also identifying effective incentives and motivators. I think if you focus on these two things, I think they will pull a lot of the other areas of opportunity with them. So people who are well compensated, who are on a professional growth track, are going to demand increasing education, getting a master's or something like that, and they'll have the resources to actually acquire those things. So in turn, the educational ecosystem will respond. Next slide, please. Okay, and so this one has a number of builds, but what I wanted to do was just select these two and then talk a little bit about the benefits, but also talk about the challenges, because the challenges are the things you're going to have to address when you want to actually implement these approaches. So in terms of benefits, job descriptions, there are clear expectations of the people who are doing work. When they're consistent, there are also opportunities for cross-training. Maybe someone knows how to do this job. They can also, based on the job description and experience, do this job. This makes for more supply chain flexibility. Performance metrics are sort of throughout this. You've got to be able to measure performance in order to improve it. Developing consistent salary bands based on what job responsibilities are, that's a really important component of this. What do you get from enhanced job descriptions? You tend to get better job performance. You get an experienced group of workers who are not necessarily attracted to the private sector, people who want to stay there and improve the performance of the supply chain. And also, if you have people who are moving up, you have leadership who has actually done the day-to-day operations work. In Costco, for example, they're headquartered where I live in Seattle. Everyone, even the most senior leaders, are required to go into the store and do some work in the store so that as they make decisions, they actually understand what's going on. In terms of challenges for job descriptions, you have to go and assess all the supply chain roles. What do they do? Who are they? You need to develop very consistent definitions of responsibilities. And then you need funding, and you need funding pretty much to address all of these. For career pathways, you need to do regular performance assessments of workers, and you need to do it in a way that's consistent across the entire supply chain. You have to make sure that people who get promoted are not promoted because they've been there a long time. They're promoted because they're people who deliver results against performance metrics. Also, bringing in private sector people, these people can give different perspectives. Sometimes that's a challenge to figure out how to do that. Having a place where people who are workers who are looking to move up can see what the new opportunities are and pursue them. And also, as you move up in terms of responsibilities, you should be making more money. So there needs to be a framework to support that. Next, Ronan. So here for incentives and motivators, for me, people do what they are incented to do, whether that's a good thing, or maybe not such a good thing. People will do what you incent them to do. If you take a look at the benefits of that, you can retain the most capable workers, right? The best people want to have interesting jobs that are challenging. They want to be compensated, and they want to be compensated for their performance, right? If I'm delivering results, I would like the leadership to recognize that in some way, and financially is the best way to recognize it. Having payments that are tied to quantitative improvements, numerical improvements, is really important. But in order to do this, right, you have to measure your performance. You want to encourage sort of out of the box thinking. Let's not just always do things the way we always did it just for that reason. A lot of times there are better ways to do things. And the people who know the better ways are the people who are actually doing the work. Somebody who's 6 clicks up, they may not know. And this is the kind of thing that drives collaboration between people who are maybe in different roles in the supply chain. And that's how you make really big change, right? By having people in different roles say, how do we improve the end-to-end process here? Some of the challenges with incentives include you need a performance-based mindset, right? Somebody who delivers excellent results is more valuable than somebody who doesn't. And this requires a sort of a different mindset than just doing the day-to-day. You need a very clear definition of what the performance objectives are. I'll show you an example in a second, but if you're ensuring inventory accuracy, we have to be very clear about what that term means, because otherwise you can't effectively measure people. Obviously, you need to capture performance data regularly and assign it to each person, right? Not assign it to a group. Assigning it to a group of people is fine, but it needs to be assigned to individuals. You have to guard against gaming the system. I worked in a place one time where the facility was really crowded with stuff. And so the only thing we could measure to start with, how many shipments were going out the door. And I saw dramatic improvements. However, when I went to the dock after a while, I realized the guy was only putting 2 boxes on one pallet and sending it out to make the metrics look better. So, you know, this is gaming the system. You need funding to implement these kind of programs. This is a very deliberate effort that takes a lot of thought. And you need ongoing funding. Incentives is not a one-time thing. Incentives should be a regular part of the way work is done, but this is how things get improved and improved and improved. And just very quickly, I'll show you an example. Next slide. Go ahead. So this was for a project I actually did managing a warehouse in the Dominican Republic, and they were unable to fill orders sort of across the board. It was becoming a real problem. And so when I got there, it was like the picture on the right. It was actually worse than that, but it took me a while to think about taking a picture. You can see it's pretty hard to operate an efficient warehouse when you can't even get down the aisles. If you look in the top left, I said, we're going to measure the accuracy of inventory in each aisle, and we're going to do a cycle count of it. And there were 2 people assigned to this. We had a baseline. The original baseline was 30% accuracy, if you can believe that. But we had a baseline now of 91%. The target was 95%. There were 2 people responsible. And this chart was at the end of each aisle in the warehouse. At the end of the week, the people who reached the target got, it was like $15 US or something like that. It was enough to interest them. And the people who weren't able to meet the target did not get it. And I'll never forget the first time I gave out the payments. One aisle, great job, you made the target. The next aisle, sorry, you didn't make the target, you don't get the payment. And they were like, what? And I said, what you need to do is talk to those guys in the next aisle and figure out how they did it. So next week you'll be paid. One more build. My whole point here is incentives work if you want to improve performance. One more, Ronan. A lot of times the thought is, oh, well, why should I pay these people incentives? They're already getting paid. But what I found here is we paid not very much in incentives, and the value we got back was probably 10 times the cost of that. However, this requires a slightly different mindset. Thanks.
Thank you, Bill. Fantastic. I'm going to pass this on to my colleague Ronan, who's going to do just a little Mentimeter with the audience. So over to you.
Hi, everyone. I'm Ronan Tiburon from People That Deliver. So to start with this call for action, we are going to first answer the following question. What is the main human resources issue you are currently facing? So to answer this, please copy paste the link that I'm sharing right now in the chat, or go to menti.com and use the numeric code here. Please don't do both, just one of the 2. Please use only keywords, not full sentences. And I will leave you 1 minute to answer, and we'll see the results in a short moment. Thank you. Any question, please ask. Thank you. We have about 15 answers. Please, everyone, try to copy paste the link and answer the question. All right, let's see the result. I see people are still answering, but let's move on and see. So what are the these you are currently facing? So skills appears a lot, but also talent, recruitment, of course, inadequacy, problème de formation, training issues, staff turnover, lack of recognition, shortage of human resources in supply chain management, competencies, knowledge gap. So a lot of them, not to say all of them, are linked to PTD's theory of change. You're going to see that in a moment. Découragé, so lack of motivation as well, competence, turnover. Thank you very much. So based on this issue, we're going to answer the following question. Which pathways from PTD's theory of change are you going to first take to resolve this issue? So same process, I'm going to share a link right now. You can whether use this link or go to menti.com and use the code 2602152. Showing the link now. I hope you pay close attention to Dominic's presentation earlier for PTD's theory of change, but if not, the 4 pathways are given in the link, so don't worry. Thank you for answering. We have about 10 replies. Thank you. Let's move on. Here are the results going now. All right, so it's balanced between motivation, staffing, and skills. We have 27% in motivation, staffing, and skills, and 80% for working conditions. So we see the 4 pathways are really important to resolve all your issues, and that's great to see. So I see that everyone will act on the 4 pathways of theory of change. for their first action, but remember all of them count. So after the first action, I recommend strongly to use the other ones for building and strengthening your human resources workforce for in supply chain. I'm gonna leave the floor for question and answer. Thank you everyone for your participation.
Thank you, Ronan. Very interesting results, and it just shows that you really need to tackle and address all 4 pathways in order to really start to build out your human resource system to support supply chains. So I'm going to, I've been sort of monitoring the Q&A a bit, and I just wanted to respond to Mohammed's comment about the STEP 2.0 program, and I just would like to really encourage you to attend next week's webinar. Also on Thursday next week, same time, we'll be presenting on STEP 2.0 together with Kevin Eder, who is leading from the Gavi side on STEP 2.0. And we'll be able to provide a lot more information on how STEP 2.0 is implemented at country level, as well as the types of different funding sources that are available. Thank you, Sozimo, that's great. The other questions that I'm seeing here are very much linked to the professionalization framework. I think there was the very first question that came in was what criteria selection were used in selecting these 3 countries. And as you saw on the map, I had identified Nigeria, Rwanda, and Mozambique. And honestly, we're still at a point in time where the way those were selected, they weren't really selected. It was sort of more organically grown in that basically in Rwanda, we have set in motion a variety of different workforce development initiatives. And this was just sort of the culmination of all the work that was done before that. In Mozambique, for instance, we actually, People That Deliver has not even been that involved, other than a lot of different partners in Mozambique have been taking that process further. In Nigeria, actually, we have been highly involved in actually even issuing a contract, receiving specific funds from USAID to drive this process together with the government, MPCMP, as well as one of the local partners, ARC ESM. But my hope here, of course, is that through such webinars, through disseminating more information on this, that we're going to be potentially looking at more countries we can professionalize. And that, just wanted to raise that we are setting up a hub, another sort of central coordinating hub to drive these supply chain professionalization efforts. We want to use this hub sort of as a common gathering point to bring in both local and global actors to foster knowledge exchange and promote best practices, and then really start to promote the standard tools that we've developed, look at some of these implementation case studies, and then champion really this forum for dissemination. Because I think I saw a question in the chat as well. Let me just open up the chat. It was about, let me see, where was it? Sorry, right there. Oh yeah, so it was really about the process mapping tool. So a process mapping tool was developed for Rwanda, but we're also currently at a point in time where we are developing out and will be publicly sharing this process mapping tool. So if you do go to our website, find the professionalization framework, which will give you a lot more insight into how this approach takes place in country. But basically, it's sort of a management tool where we're looking at, you need to start with advocacy, then you look at how to scope the work, and then you really start to identify the different processes that need to be mapped to supply chain roles. And as you can imagine, it's a sort of has a long-term vision. We're really looking at identifying and creating resources to help countries go through this process. Let me see, I see a number of other messages coming in. Okay, great, just thank you for the congratulations. And I think there was also a couple of questions answered by Michael as well. And I realize now also that we're over time. But I was also glad, Michael, thanks for answering Barbara's question, because it is really, the Civil Service Administration plays a very important role. And when we do this advocacy piece in country, that's when you start to look at all the key stakeholders that need to be involved in these discussions around professionalization. Ministry of Health, of course, extremely important, but the civil service as well. And then the idea there is to have a specific country body that will take this further. And so they need to include all those key stakeholders. So I would just see if there's, if anybody has anything else to add from the panel. If not, I'm gonna pass this on to Alexander. And I just wanna thank the audience for being here today. Thanks so much. Do join us next week and in the following weeks. And thanks again.
Thank you very much, Dominic. Yes, we are over time, so we need to wrap up. Thanks a lot for this excellent presentation, everyone. We hope to see you next week again for this for the second session of this series. Just to remind the topic, that's building leadership and management capabilities with public and private sector collaboration, and there will be a country example. In the meantime, we'll share all the links to the videos and the slides as said during the introduction. Take care and see you next week, same time. Bye-bye.